little over a year ago, actually 14, 15 months ago, I got that call that every parent dreads. 5 in the morning, the phone rings. It's a doctor from Rockville General Hospital calling to say my son Timothy was brought in after a cardiac arrest from an overdose of heroin. I jumped up, my wife and I jumped up, ran to the hospital, called up my other son to meet us there. When we got to Rockville Hospital, my son Timothy was on a stretcher, basically dead. He took powerful medications just to get his heart beat up and get some blood pressure. He was not breathing. He was not aware of anything around him. In fact, at Rockville Hospital, doctor said, there's nothing more we can do. We got to get him into Hartford to a trauma center. Let's see if something can be done. We rushed down there to Hartford, and we didn't get any better news. We saw a cardiologist, neurologist. They had repeated a CAT scan, and Tim had what was called a catastrophic brain anoxia. What that means is anoxia is a lack of oxygen. There was no oxygen getting to his brain when his heart stopped after the overdose. And at this point, they said, there's nothing we can do. He's not coming back, most likely. Being a 29-year-old, otherwise healthy young man, we decided we got to give him some time. And let's see if he can recover. Let's see if something can come from this. We're very fortunate. My wife and I have very big families, and we had a lot of support. We took over the waiting room at Hartford Hospital there. And the whole family sat with us vigil for 36 hours. We sat by Tim's bedside, hoping to find something positive, something to have us look forward to. Instead, it was just the opposite. We saw signs of worsening brain damage. And my wife and I are both medical professionals. We knew what we didn't want to admit from the beginning, that this wasn't going to end well. After talking with the doctors again, my wife and my son Brendan sat down and had to make the decision to let Tim go. We knew this. We had to make a decision. We knew we were going to probably second guess ourselves a million times, and I still wonder if we did the right thing, but we decided we had to let him go. Let all our family come in and say their last goodbyes, and we had the staff there turn off the ventilator. It took about 5 or 6 minutes. His heart stopped for the second and the last time, and he was gone. I try to wonder, how could this happen? We live in Ellington. This doesn't happen in Ellington. We, as parents, we try to do the right thing. We raise the kids up. We did all the right things. We read to him in utero. We played classical music. We did all the things the experts say we should do for your children. Raise them in a loving, large family where there's a lot of love and support. And you think you do the right things, and things are going to turn out right. And it scares you how that's not always the case. One thing that happened with Tim, as he was growing up, he was a typical kid. He was involved in, he loved sports, music, arts. He was on the baseball team, he was on the track team. But in his senior year, or late in his junior year, things changed for him. His world got dark. He started becoming much more isolative. He would often write song lyrics with themes of death and even suicide. And we were certainly very alarmed by this. We got him into treatment. He was diagnosed with having a severe depression and also debilitating panic attacks. We tried different treatments, different medications. Sometimes these meds have side effects and they're unpleasant. They don't always work. And a lot of people, my son one of them, many of us don't want to have to take medication for things like that. We got to tough it out. And so he struggled a lot with just his depression and his anxiety. He worked a lot as a cook. He worked in a lot of area restaurants. And I'm not blaming anybody or any situation, but a lot of kitchens are a hotbed of drug use. It's problematic all over the place. And I wonder if that's where he first got introduced to using opiates. He started on pain pills that you can buy on the street, OxyContin, Vicodin. And I imagine they made him feel good. But somebody can imagine who's depressed and have severe panic attacks. Tim wasn't a happy person. If he could take something to make him feel good, even for an hour, why not? Why not? No one knows they're going to be an addict. No one decides to be an addict. Everyone thinks, I got this. I can handle this. He used to say, I'm not stupid like those guys. I can handle this. But he couldn't handle it. His use worsened from taking the pills. At one point, we found that he was crushing them and smoking them, the opiate pills. And we found the little foil wrappers in his room with the little burn marks. And we got him into treatment. Said, this is it, we got to get you into treatment. He went into a rehab for 3 weeks in a Rushford Center in Middletown. And he thought, all right, I'm really going to do this. I got a handle on this. Came out, went to an intensive outpatient program, but he relapsed. Something happened, I don't know what happened, he used again, and they kicked him out. So you can't get treatment if you relapse, which I don't kind of get. We're so much more aware now that addiction is a medical illness. Relapse is part of recovery. Most people who go into recovery relapse, not all, some are lucky, but many of them relapse. That's part of it. Just like if you have a problem with diabetes, you're going to have relapses. You're going to go off your diet, and things are going to get worse. We don't throw someone out of treatment, but that's what some treatment programs do. But anyway, so he was thrown out. He continued in individual therapy, again, trying to treat his mental health issues. But at some point, he just continued. One day, he was home, and there was something acting very odd or suspicious about him. And my wife said, Tim, come here, what's going on? And he's feeling something in his pocket. And we made him pull it out. He pulls out a needle. So I almost hit the floor, fainting. No, this can't be happening in our family. He's got a needle now, he's shooting heroin. I don't know anybody who shoots heroin. I've never been involved in that in my life. How does this happen? So head spinning, we try to get him into treatment. Anyway, sit back, call your work. You're not going into work today. You're sitting on that phone right now, getting back into treatment. He did get back into treatment eventually into another rehab, but both times he got into rehab, it took 14 days of sitting at the phone every morning, calling. There's no bed available. Try calling tomorrow. 14 days. How many people have that kind of stamina? Thankfully, he had his mom or I sitting right next to him, making him make that phone call. We were fortunate that we had that much control, if you will, to get him into treatment. But it shouldn't be that hard for people to get treatment when they're looking for it. But eventually got into treatment. He thought he did better. He came out, went into a sober living situation called the Sober House, which is not the greatest, at least this place was not the greatest of places. There's a lot of problems with sober houses, as there is with all of our system of treating mental illness and addiction. And then we found out after he had died that he was thrown out of the sober house a few days before that we had known about that. We thought, why was he in Rockville Hospital when he was at a sober house in Manchester? It's a hospital across the street. The EMTs had to tell us, well, he wasn't there anymore. He was living in somebody's house in Ellington, had to get thrown out of a sober house. One thing you heard a lot here about shame and stigma. Besides heroin, I think it was shame and stigma that killed my son. I really believe that. There was a lot of difficulties in the family, as some of you know, or others can imagine. In all the years of his struggle, there was arguments and doors slamming and yelling and crying and tears on and on again in our family, trying to find a system, something that works. My wife and I tried everything. We tried tough love. People say be hard on him, let him hit bottom, don't enable him. I hate when people enables. That's it. We got to get rid of that label. We can't stop blaming people. And then we tried other ways. We were trying to be super nurturing and do everything we can, but it didn't make a difference. It wasn't about what we did. It had to be something that he had to find inside himself. And when he got thrown out of the sober house, we would have taken him back in the house. Would we have been upset and angry? Yeah, I would have. He probably would have heard a load from me. What the heck's going on again? But we would have taken him in. But I think it was his shame. He knew the trouble. He knew the shame, the pain he brought on his family. He couldn't admit that to us. He tried to tough it out on his own, and it didn't work for him. So, as has been said before, this is my mission now. One thing Tim did, he tried to get other people into treatment. He was the guy friends could call. They needed a ride to the NA meeting. Or he brought people into his Suboxone group. So even though he didn't make it, he believed that recovery was possible. And it is possible. There are people here in this room today who know that, who has experienced that recovery is possible. I don't want it to all sound horrible. It is possible, and that's what we want to motivate people. But it's the shame and stigma, again, that gets in people's way. They're embarrassed to talk about it. I give an example, as has already been said here, though. Imagine two families in this town live across the street from each other. On one side of the street, there's a family where they have a young person that's suffering from cancer. It's a horrible, debilitating disease. It can be terminal. They could wind up dead. And what's the neighborhood response? Everybody's bringing over casseroles. Everybody's calling to see, can I help out? Is there any way we can help? Do you need a ride to the hospital? People are talking about this brave family and what they're going through. Now across the street, there's someone with a young person who's a drug addict, who's abusing heroin. You think anybody's sending them a casserole? You think anyone's calling to help out? You think anyone's talking about that brave family? No, they're talking about, that's those people there. Stay away from them. They're shunned. Why is that? And you wonder why people are ashamed to talk, to speak up, to admit their problem. And that's why so few people go for treatment. I'm talking about Tim struggles both mental illness and addiction. They're ashamed, and their family's ashamed. We got to end that. We got to accept this is a medical illness. It can be treated, but it's a chronic illness, and it takes a lot of treatment. It takes wraparound treatment. It takes medical assisted treatment often, and counseling, and intensive therapies, and NA, and 12-step supports like that, where people can go and have a community of people who understand that struggle and are ready to help each other. And it has to be lifelong. There are going to be relapses. But we have to find a way to, first of all, accept, say it's okay that people have this problem, pull them in. If you know someone, tell them you love them, tell them you support them. You can't do it for them, but you support them. You're not going to turn your back on them. And they're a good person, you know that. This happens to good people. It's not about poor parenting. It's not about moral failures. It's about a disease. Some people are lucky enough that they made a choice. Some people haven't made that initial choice. It was their doctor who prescribed it. And then they became an addict. So it's not always an initial bad choice. My son, it was a bad choice, but he was trying to feel good. And even after you start abusing these drugs, initially it feels good. I can imagine, again, as I said, he had moments where he felt great. But after a while, once you're addicted, you're not feeling good anymore. Dr. Wolf said, you're just trying not to get sick. You're trying to survive the day. And it affects their brain thoughts. It affects their frontal lobe, where their judgment and their reasoning is. We say, how could they do that? How could someone turn their back on their family? How could they steal from their family? How could they lie? Well, you know, they're not thinking clearly. They can't think that way. All they can think is, how do I get through the day without dying? That's what their quest is. So imagine how that must feel, that desperation. And so we got to have more compassion for people. A couple more minutes. People often ask me, you know, what can we do? In honor of my son, we started a group called Today I Matter. And this is what I'm doing now. I'm going around doing talks, trying to educate people, help reduce the shame and stigma of mental illness and addiction. And people often ask me, you know, what can we do? If you bear with me, I have a list of a few things that any one of us can do with no money, no special training. Number one, be aware that mental illness and addiction happens to good people from good families and can happen, and in fact may be happening to someone you care about. Number two, accept the fact that addiction is a chronic medical condition and that setbacks are common. Number three, believe that treatment for mental illness and addiction is available and medical management is possible. Number four, accept that alcohol abuse is drug abuse. Too often we excuse that. Number five, be aware that any instance of substance use by teens increases their odds of eventually developing an addiction. You know, our brains are not fully developed till our early 20s. For each year before that, we introduce any substance to a young person, be it alcohol or marijuana or even cigarettes. It changes things. For each year earlier, it increases their risk of eventually becoming an addict. Very rarely does someone become an addict if they haven't used any substances till after 21. It's almost zero. And so for each year earlier, you have a more chance. So when we talk about, the officers have talked about marijuana too, especially on the teen brain, it's highly risky. Or you're playing with fire, even drinking, you know, giving your kid a beer, you think that's fun? The kid might be fine and it probably will be okay, but you're increasing the risk that someday he can become an alcoholic. So just know that from day one. Treat those struggling with mental illness or addiction and their families with compassion and non-judgment. Demand that our schools provide ongoing education and teach realistic facts about drug and alcohol use to our students. Demand that our police officers, teachers, and medical providers are trained in mental health first aid. If some of you care about uses opiate substances, whether prescribed or not, make sure that Narcan is obtained. I'm going to reinforce what's been said. Everyone can have Narcan. Remember when we were growing up, our moms always had Ipecac in their medicine cabinet in case somebody got poison control, right? Everyone should have Narcan in their homes. If anyone takes this, even if it's prescribed, some people go to the dentist, they get OxyContin, or they get Vicodin. Have Narcan in the home. Narcan is saving lives every single day. Advocate that our school nurses are provided with Narcan and trained in its use. Contact your legislator at the state and federal level to make mental illness and substance use disorders priorities for funding and oversight. And one last thing I'll say, one thing we don't talk about enough, I don't hear about enough, the Good Samaritan law in Connecticut. The officers, I'm sure, know it better than I do. But if you're with someone who overdoses, call 911. You will not get arrested for calling 911. If you're with, huh?
Neither will they.
Neither will they.
Neither will they.
So there won't be an arrest. I mean, if there's an outstanding warrant, that's something else, right? But we have a friend of Tim's. Heard from his mom that he died from an overdose in a car with his friend. His friend drove around with his dead body in the car for 12 hours, scared out of his mind, not knowing what to do. Now, if he had known that he could have been safe to call 911 right away, maybe this young man would be alive, I don't know. But imagine the terror in that other young person who thought he was in a problem he didn't know how to get out of. So let everybody know. You can call for help. And if you use Narcan, that's not enough. You call 911 anyway, even with that. Because a person with someone uses Narcan for an overdose, they're going to wake up and immediately go into withdrawal. And they can get agitated, they can have problems, and then Narcan wears off again. Within 45 minutes, they can go back into the overdose state. So you always call 911. Thank you very much for your time.